I want you to imagine, just for a second, sitting in a clinical hospital chair. You're just waiting.
Yeah, that awful waiting period.
Exactly. Maybe it's for, like, your third chemotherapy session this month, or maybe you are just waiting for the results of a biopsy to tell you what your future looks like.
Right, the anxiety is just palpable.
And the fluorescent lights overhead have that harsh, relentless buzz. The medical machinery around you is beeping in these different overlapping rhythms.
Oh, the sensory overload in those places is very real.
It really is. Your body feels incredibly heavy, and your mind is just calculating all the unknowns of a cancer diagnosis. But then, someone hands you a pair of headphones.
A small escape.
Yeah. You slip them on, your favorite song starts to play. And I mean, we've all used music to cheer ourselves up after a long day, right?
Of course, it's human nature.
But what if your favorite playlist wasn't just, a psychological distraction? What if it was a literal, measurable medical intervention?
Well, that's where the science gets really fascinating.
Right, like an intervention capable of altering your blood pressure, your immune system, and your physical perception of pain.
It fundamentally changes how we view something we just consume every single day.
Yeah.
When you're in that clinical environment, you're stripped of your agency and subjected to a battery of invasive procedures. Your environment is entirely out of your control.
Totally out of your control.
And we tend to view music in those moments as just a comforting blanket. But treating it merely as a comfort ignores this growing mountain of clinical data.
Which is exactly what we're getting into today.
Right, data that suggests it is actively shifting the physiological state of the patient.
So today, our mission for this deep dive is to figure out if that simple act of listening to music genuinely improves physical and psychological outcomes for cancer patients, or, if it's just a luxury in the hospital ward.
A very important distinction to make.
For sure. We are looking at a 2022 Cochrane review that gathered data from dozens of clinical trials, alongside a blog post that synthesizes all these really dense findings.
And synthesis is key here, because the raw data is intense.
Oh, absolutely. So, okay, let's unpack this. Because to move beyond a nice anecdote into hard science, we have to look at the methodology.
Exactly, the foundation of any good claim.
Right, and from what I understand, a Cochrane review isn't just your standard everyday literature review.
Oh, far from it. The Cochrane database of systematic reviews is widely considered the gold standard for evidence-based medicine worldwide.
The gold standard, wow.
Yeah, they don't just conduct new, isolated experiments. Instead, they act as an aggressive filtration system for existing global research.
So they're aggregating all this data to find, the absolute truth?
Exactly. They cut through the noise of single, potentially flawed experiments to see what actually holds up when you look at the entire landscape of medical science.
And the scale of what these researchers looked at, and by the way, they're based out of some highly respected U.S. universities, it is frankly staggering.
It really is a massive undertaking.
I mean, we are talking about 81 separate clinical trials involving over 5,500 people with cancer.
And having over 5,500 participants, that is a crucial threshold for a behavioral intervention.
Why is that specific number so important?
Well, in clinical research, a large sample size provides statistical power. You aren't just looking at a fluke,
Right, or like a placebo effect in a small group of 10 people who just really happen to love jazz.
Exactly. You are looking at consistent, undeniable biological and psychological patterns across thousands of diverse patient experiences, different countries, ages, types of cancer.
That makes total sense. Now, looking at their methodology, they searched multiple databases between 2016 and 2020.
Right, a very thorough window.
Yeah, so like Medline, Abeyance, SunnyHL, Psych&Info, and specialized ones like Cares for Music. And I assume searching all those different databases isn't just to, pad their bibliography.
No, not at all. It's a very intentional strategy.
Because if you only search one major database, you might only find the shiny, successful studies, right? The ones that journals love to publish.
That is precisely the issue they're trying to avoid.
You have to dig into the obscure databases to find the studies where the intervention maybe didn't work as well. Otherwise, your data is suffering from publication bias.
Exactly. Publication bias really skews our understanding of medicine because negative or neutral results often just get shoved in a drawer.
Which is terrifying when you think about it.
It is. So by casting such a wide, exhaustive net, the Cochrane researchers ensure they are looking at the ugly data right alongside the pretty data.
Okay, so they get everything on the table.
Right. But they take it a step further. What's fascinating here is the absolute rigor of the bias checks detailed in the review.
Yeah, I read about this. It sounded intense.
The methodology demands that researchers practically interrogate every single study before including its data in the final synthesis. For example, they evaluated something called allocation concealment.
Yes. Allocation concealment. I read that term in the sources, and it sounds like something from an espionage thriller, like hiding government assets.
I love that. It kind of operates on a similar principle of supreme secrecy, but for data integrity.
Okay, how does that actually work in a hospital?
It literally means the researchers looked for original clinical trials that used serially numbered, opaque, sealed envelopes.
Wait, really? Sealed envelopes?
Yes. They used them to assign patients to either the music therapy group or the standard care group.
I want to make sure I'm visualizing this correctly. So instead of a doctor just looking at a list and saying, well, patient A gets the music, patient B gets standard care, they are physically dealing out sealed envelopes.
That's exactly it.
Like dealing a deck of cards face down so the dealer can't possibly stack the deck for their favorite player?
That is the perfect analogy. Because humans, even highly trained medical professionals, are inherently biased.
Oh, sure. Subconsciously, we all are.
Right. If a well-meaning nurse knows which patient is going to get the music intervention, they might subconsciously choose a patient who they think is, more upbeat.
I'm more likely to respond well to the music, yeah.
Or, conversely, they might give it to the patient who looks the most distressed, just hoping it helps them.
Which makes sense emotionally, but it ruins the data.
Exactly. Either way, that subconscious choice completely rigs the results of the trial. The opaque, sealed envelopes ensure that nobody can game the system. The selection is truly mathematically random.
So it completely removes the human error of trying to, help the study succeed.
It does. And they apply that same ruthless scrutiny to dropout rates, too.
Oh, interesting. How so?
They graded the certainty of the evidence, categorizing it as high, moderate, or low. If a study had more than 20% of its participants drop out,
That's a lot of people to lose.
it is. Or if the researchers failed to clearly report why those patients left the study, the Cochrane reviewers flagged it for a high risk of bias.
Oh, because if all the patients who didn't enjoy the music drop out and you only measure the ones who stayed, your results are completely artificially inflated.
Exactly. You're left with a biased sample. They only want to rely on studies where the finish line represents the entire starting group.
Okay, so the researchers built a bulletproof study. No cheating allowed, no cherry picking the best results, no stacking the deck.
The purest data possible.
So did the music actually hold up under that kind of pressure? Or did the placebo effect just vanish when the scientific spotlight got too bright?
It absolutely held up.
Because looking at the numbers from these 17 randomized controlled trials, featuring 1,381 participants, anxiety scores dropped by an average of 7.73 points.
And let me tell you, a 7.73-point drop is a massive clinical victory.
Really? It sounds like a lot, but I wasn't sure how to weigh it.
We have to contextualize that on a standard anxiety scale, like the State Trade Anxiety Inventory. Anxiety in a cancer ward isn't just feeling a little nervous about a needle.
No, it's existential dread.
Right. It can be a debilitating state of hyperarousal. A drop of nearly 8 points can literally mean the difference between a patient experiencing a full-blown panic attack before a chemotherapy session versus being able to sit calmly.
Wow.
Yeah, being able to regulate their breathing and tolerate the medical intervention without requiring a sedative.
That is incredible. But the psychological wins kept going, and this is where I need some help translating the clinical jargon.
Sure, hit me.
The review states that across 12 trials with over 1,000 participants, depression was 0.41 standard deviations lower in the music group compared to the standard care group.
Okay, standard deviations.
Right, and mood improved by 0.53 standard deviations. Hold on, 0.41 standard deviations. I haven't taken a stats class in a decade. What does that actually look like for a human being in a hospital bed?
It is a great question, because standard deviations can sound like abstract math instead of human experience.
Exactly, it's hard to picture.
Think of a bell curve representing the mental health of all the cancer patients in the hospital. The bulk of the patients are right in the middle, experiencing a heavy baseline of situational depression.
Okay, I'm with you.
Moving nearly half a standard deviation down that curve is not just a statistical blip. It means a patient who is perhaps in the 50th percentile for depressive symptoms.
Like struggling to find the motivation to get out of bed or speak to their family.
Yes, exactly. That patient has shifted noticeably down the curve. It is a palpable shift from clinical impairment to a state where they can function and actually engage with their environment again.
The review also mentioned that hope increased by 3.19 units. Wait, how do you even measure hope?
It sounds impossible, right?
It really does. Is it a questionnaire? What are they asking these patients to quantify something as abstract as hope?
Well, clinical psychology uses validated tools, like the Hearth Hope Index.
The Hearth Hope Index, okay.
Yeah, it is a carefully designed questionnaire that doesn't just ask, are you hopeful? It asks patients to rate their agreement with statements like, I have deep inner strength, or I can see a light in a tunnel, or I have a sense of direction.
Oh, that makes a lot of sense.
And an increase of over 3 units on these scales indicates a profound shift in the patient's internal narrative. They're moving away from despair and actively beginning to conceptualize a future for themselves.
That's beautiful. But here's where it gets really interesting for me, because you might hear all of that and think, sure, music makes you feel better emotionally. It's a nice distraction. It's all in your head.
A very common misconception.
But this review tracked physical symptoms too. Across 632 participants, pain dropped by 0.67 standard deviations, and fatigue levels improved.
Yes, physical, measurable changes.
And fatigue is one of the most brutal, draining side effects of cancer treatment. So a simple acoustic intervention is making daily life physically easier. How is sound doing that to the physical body?
It essentially comes down to the neurological pathways connecting the auditory cortex to the nervous system.
Okay, let's dig into that.
The researchers looked at hard physiological outcomes: reductions in heart rate, a slowing of the respiratory rate, drops in systolic and diastolic blood pressure, and even better oxygen saturation.
Because we know that cancer triggers severe anxiety, and we know anxiety isn't just an emotion, right? It's a physical cascade.
Exactly. The brain interprets the clinical environment and the diagnosis as a massive existential threat, which shifts the autonomic nervous system into sympathetic overdrive.
The fight or flight mode.
Right. This floods the bloodstream with cortisol and adrenaline. Your heart rate accelerates, your blood vessels constrict, and crucially, your pain receptors become hypersensitized.
So the anxiety is literally turning up the volume on the physical pain they're experiencing from the tumors or the treatments.
Yes, precisely. But when you introduce music that the patient finds familiar and comforting, it stimulates the vagus nerve.
Oh, I've heard of the vagus nerve.
Yeah, it's key here. This engages the parasympathetic nervous system, the rest and digest state. It acts as a neurological brake pedal.
Ah, so it forces the body to slow down.
Exactly. The heart rate naturally slows. Blood vessels dilate, lowering blood pressure. The physical tension in the skeletal muscles releases, which directly reduces the sensation of pain without adding another pharmaceutical to the patient's chart.
That is wild. And the review even noted improvements in immune system functioning, specifically looking at immunoglobulin A or IgA levels.
Yes, IgA is a fascinating metric.
Now, IgA, isn't that the primary antibody found in our mucous membranes, like in our saliva and our respiratory tract?
It is, yeah.
How does listening to a song actually change the chemical makeup of our mucus?
It has to do with the metabolic cost of chronic stress.
Okay.
When your body is constantly in a state of high alert, producing massive amounts of cortisol, it suppresses non-essential functions to conserve energy for the perceived immediate threat.
Right, because it thinks you're running from a bear, not fighting a long-term illness.
Exactly. And one of the things it suppresses is the production of secretory IgA, leaving the mucosal linings vulnerable to infection.
Wow.
By forcing the body out of that stress state and back into a parasympathetic state, music removes the suppression. The body can resume its normal, vital immune defenses.
And on top of all these internal metrics, the review observed better communication, right? More verbalization, positive facial affect, gestures, and enhanced social and spiritual support.
It's all connected.
The patients aren't just biologically healthier, they are physically and socially opening back up to the world around them.
It really acts as a bridge. When the physical burden of pain and anxiety is lowered, the patient finally has the energetic bandwidth to connect with their loved ones and their care team.
So we've established that the intervention works marvelously, both for the physiological markers and the psychological toll. But if I'm listening to this right now, I'm probably wondering about the logistics.
The practical application, sure.
Yeah, the best news from the blog post synthesis is that this massive benefit did not require a trained music therapist.
That is a very important point.
Simple music listening made a massive difference. Patients just chose their favorite songs or relaxing tracks and listened on their own.
Self-selected music.
But I want to push back on this a little bit. If I can just use my Spotify playlist, put in some earbuds, and get these incredible, scientifically proven results, why would a hospital ever pay for a professional music therapist?
A fair question.
Isn't that just a massive waste of hospital resources at that point?
It is a completely fair question, but it requires distinguishing between passive receptive listening and active clinical intervention.
Okay, what's the difference?
What we are discussing today is receptive music therapy, the patient passively absorbing the sound. Active music therapy, guided by a board-certified professional, is an entirely different toolkit.
How so?
Well, a therapist might use clinical improvisation or songwriting to help a pediatric patient process the trauma of losing a limb, or use rhythmic auditory stimulation to help a neurological cancer patient rebuild their motor skills and learn how to walk again.
Oh, I see. So it's the difference between doing intense, targeted physical therapy with a professional after a surgery versus just making sure you go for a daily walk to maintain your baseline cardiovascular health.
That is the perfect distinction.
Both are highly beneficial, but one is a specialized medical service and the other is a daily habit you control.
Exactly. What this Cochrane data shows us isn't that therapists are obsolete, but rather that the baseline accessibility of music as a medicine is phenomenal.
Because anyone can do it.
Right. It empowers the patient to take immediate control of their own environment. And the element of choice is structurally vital to the outcome.
Yeah, that makes sense.
What is relaxing to one person might be highly irritating to another. If a hospital pipes in generic classical music, it might calm one patient, but severely annoy a patient who hates classical music.
Which would just spike their cortisol again.
Precisely. By allowing patients to self-select, you guarantee the highest level of personal comfort.
And the data highlighted a key finding regarding that self-selection. The frequency matters.
Yes, consistency is huge here.
The study showed that the more regularly patients listened to their chosen music, the more robust the psychological and physical support felt.
It's a cumulative effect.
It isn't just a one-off event where you listen to a song and you're cured of anxiety for the week. It's about building a simple daily habit of like 10 to 15 minutes of intentional listening.
And if we connect this to the bigger picture, the absolute beauty of this intervention is its complete lack of clinical friction.
What do you mean by clinical friction?
Well, it is a safe, complementary approach. In all 81 clinical trials involving over 5,500 patients, there were 0 harmful effects reported.
Wow. Which you can't say for almost any other medical intervention.
Not at all.
Even basic over-the-counter painkillers have gastrointestinal side effects.
Precisely. It costs the hospital and the patient absolutely nothing. It requires no extra physical effort from patients who are already exhausted by chemotherapy.
They're already tapped out.
And importantly, it doesn't cross-react or interfere with any anesthetic or analgesic medications they're already taking. It doesn't put an extra load on their liver or kidneys.
It's just clean.
It is pure, unadulterated, biologically active support.
So, what does this all mean? If we wrap up the data we've explored today, music is obviously not a miracle cure for cancer.
No, of course not.
Nobody is claiming that a good playlist shrinks tumors. But what this rigorous, bulletproof Cochrane review proves is that music is a scientifically validated, gentle, and entirely free tool to help patients reclaim a moment of peace.
That's beautifully said.
It lowers anxiety by nearly 8 points. It physically dilates blood vessels to reduce the sensation of pain. It lowers fatigue, and it re-engages the immune system.
It eases the heavy, holistic burden of cancer treatment.
It really does. Patients reported that it helped them feel more like themselves again. And honestly, in the middle of a severe medical crisis, when you are surrounded by buzzing lights and beeping machines, feeling like yourself again is invaluable.
It restores a fundamental sense of humanity in a process that often feels deeply mechanical and, frankly, dehumanizing.
Now, I want to pivot directly to you, our listener. We just went through a tremendous amount of dense methodology today.
We really did. A lot of heavy science.
Yeah, things like allocation concealment, standard deviations on a bell curve, the physiological pathways of the vagus nerve and secretory IgA.
It's a lot to take in.
It is. And keeping up with dense clinical trials like the Cochrane Review can be incredibly overwhelming, especially if you are trying to stay informed without getting bogged down in hundreds of pages of academic jargon and statistical tables.
Which nobody really has time for.
Exactly. So if you want to easily find the latest, most important research papers, complete with clear explanations, just like the ones we unpacked today, and direct links to the original studies, the Orium's Fit Research Digest is absolutely the best place to go.
It's such a fantastic resource.
It really is. It does all the heavy lifting of filtering out the noise and finding the signal, so you can just focus on the actionable insights and the aha moments.
Because understanding the mechanisms behind these studies is how we turn abstract science into applied daily practice.
Absolutely.
And speaking of applied practice, this raises one final provocative question I'd like to leave you to ponder.
Ooh, all right. Let's hear it.
If simply listening to our favorite self-selected music has this measurable, undeniable impact on the physiological and psychological markers of cancer patients undergoing immense life-altering stress,
Yeah.
how might intentionally curating our own daily audio diet act as a preventative medicine for our everyday stress, our immune health, and our overall well-being?
That is a fascinating thought.
Right. If 15 minutes of intentional listening can physically lift the crushing weight in that hospital chair, just imagine what it could do for your baseline health tomorrow morning.